It's Dr. Adam Nally coming to you this evening, talking a little bit about ketogenic diets and C-reactive protein, or what's called CRP. This is going live stream with Facebook right now on my Dr. Adam Nally page. And then once this is completed, I'll roll this over to my YouTube page. So if you're signing on live, great, welcome. Tell me where you're from. If you're signing on, or if you're seeing this for the first time on my YouTube page, I'd love to have you comment and let me know where you're at as well. Check out the links below to my website, to the other YouTube channels as well. And also, please share this out if you find my content helpful. I've had a couple people ask me in the last while or last few months about C-reactive protein. A lot of people have been taught that C-reactive protein is a marker of heart disease, and that's actually true. C-reactive protein is what's called an acute phase reactant, and it's produced mainly by the liver, but some other cells as well. And this particular enzyme is a flag that says, hey, there's either infection or there's inflammation going on. And so it's important that you identify it. We started using CRP most specifically because it was one of the ways that docs said, hey, we know your CRP is high and you've got a mildly elevated cholesterol, so that's a good reason for a statin or one of those cholesterol-lowering drugs. And that's really where it caught on in regards to its use with heart disease and those kind of things. The challenge is that CRP isn't the end-all be-all. And I have a lot of people that when we talk about their cholesterol and I say, hey, your cholesterol is normal, your insulin levels are normal, they say, well, why didn't you check my CRP? And I'm going to show you why you don't need to do that. If you haven't seen my LDL and total LDL cholesterol videos, check them out on youtube.com/Dr. Nally, and you can see those there. And that's really where that comes to play. And it will give you a lot of information about the cholesterol components. This is just going to be a shorter video talking about CRP and how it works and why it works. And so what I wanted you to do is I want you to see this video here. I'm going to bring this into the screen so you can see it. And hopefully you can see my mouse. And I realize if you're on a phone, it's probably small. I'm going to see if I can shrink it. Oh, maybe this way. There we go. And I'm in the way. So let me try it this way. See if it works any better. No, that's not going to work either. I just got this beta site for my video uploading, and so it's not as effective. So anyway, let me put it in here. So this right here is your fat cell. Your fat cell produces a whole bunch of hormones, 8 of them right here specifically. And insulin resistance is driven not so much by a problem with the insulin itself, but an overproduction of insulin because the insulin can't get to the liver and counter-regulate it. We've talked about in other videos that the liver produces glucose, and the whole job of the liver is to maintain a glucose level for the brain somewhere between 70 and 100 milligrams per deciliter. Insulin is a counterbalance that's produced by the pancreas and has a feedback loop that goes back up and tells the pancreas, hey, you can slow down your production. As the fat cells get bigger and bigger, they overproduce hormones. Specifically, in this case with CRP, 2 hormones called tumor necrosis factor alpha and interleukin 6. And we know from some science and a number of recent studies that tumor necrosis factor alpha directly inhibits insulin and makes the insulin signal going back to the liver not recognized, so the body produces more insulin to get the signal to move through, and so you see this increase in insulin. As insulin goes up, we see the fat cells get bigger and bigger because insulin drives triglyceride directly into the fat cell. So the challenge is you have these fat cells that are overproducing hormone because of a high insulin, and insulin's going up, and so you see this continuous gain in weight, and you see this continuous increase in overproduction of hormones from sick fat cells, and the blood sugar starts to rise and creep up. And so if your fasting blood sugar is over 100, you have insulin resistance. And that's being driven by this counter-regulatory balance between the fat cells, the liver, and the pancreas. In regards to CRP, what happens is tumor necrosis factor alpha actually stimulates the liver to make more CRP. Now, CRP stimulates what's called the complement pathway, and it's what drives the inflammation to occur. CRP actually is the signal that pulls the small, dense LDL particle into the lining of the vascular wall, leading to atherosclerosis and blockage of the arteries and heart disease. So what I wanted you to see is that CRP is actually driven by an abnormal function of tumor necrosis factor alpha and an overproduction of insulin. So if I check your labs and your insulin levels are normal and your small dense LDL particle is normal, there's no necessary need to check CRP unless I suspect there's an infection someplace else, because CRP is actually driven by tumor necrosis factor alpha and a counterbalance of insulin. So CRP is not its own hormone. It's just a marker along the pathway of inflammation, either because of infection or because of inflammation, and that's really what CRP does there. So I hope hopefully that gives you some clarity. There's a lot of hormones that are there, and I realize this may be kind of confusing, but the nuts and bolts of it is this: we don't necessarily have to check CRP if your triglycerides are under 100, your small dense LDL particle is down under 500, and your insulin levels are fairly normal. That's really what it comes down to. So I know a bunch of people have signed on, and I'm going to try to answer a couple of questions about this issue. And so I appreciate you guys joining on here. A bunch of you signed on. I want to say hello to all of you. From all over the country, Georgia, Vancouver. This hopefully will be helpful for you in Nebraska. Oh, wow. Okay, cool. If you have a question about CRP or you have a question about insulin resistance, please pop it in the chat box, and I'll try to answer it here in the next few minutes. And I will close this box out so you can see me a little better. But hopefully that gives you some information and gives you a little bit of clarity there. Jamie says she grabbed my book from the Keto Cure Audible. Oh, thank you, Jamie. I appreciate that. Hello, Robin from Lincoln, Nebraska. Oops, let me pop that back up there. Hello from Missouri. There's Linda in Missouri. It's good to see you. We've got people from all over in Canada, everywhere. Thank you guys for signing in. Happy Sunday to you too, Julia. It's good to see you. Oh, wow. Nova Scotia. Pauline in Nova Scotia is signing in. Thanks. It's good to see you guys. So if you've got a question about this or a question I can answer, hopefully that's helpful. Like I said, this is live on Facebook right now, but it will roll over to YouTube in the next, hopefully a few hours. We'll have it there so people can see it there as well. I look great. Sheena, you're very kind. I had my ears lowered recently. Got my hair cut, and I think that helps. Some days when my haircut gets a little fraggly, I get a little worse off. Let's see. I'm just looking to see. Jess from Melbourne. That's awesome. That's Janet from Maine. It's good to see you guys. Okay, cool. Hopefully that answers your questions. Like I said, if there's any questions, pop them in. Otherwise, I'm going to sign off and have some dinner. My wife's made a yummy dinner tonight, so I'm looking forward to that. So I'll give it just another second. So if you've got a question about insulin resistance and a question about the tumor necrosis factor alpha, remember tumor necrosis factor alpha drives cancer growth, drives a lowering of nitric oxide, which actually is part of the process in regards to rise in the blood pressure. So this hormone pathway we talked about really drives that whole issue. So let's see. Mary says, if you lower your A1C and your insulin level, will high blood pressure begin normalized? Yes, it will, Linda. And this is the exact reason why. Let me go back here and show you. See, as you drop tumor necrosis factor alpha down, CRP drops and nitric oxide goes up. And that actually allows for a normalization of blood pressure. This is why I see blood pressure normalize within 2 weeks of just shifting to a ketogenic lifestyle. So hopefully that helps. Would turmeric be a good for insulin resistance? Not necessarily. Turmeric has some anti-inflammatory property, and it does play a role in helping your body to handle the sugar more effectively, but turmeric alone does not seem to solve the problem. Now, the isolated active ingredient in turmeric is berberine, and it works a lot like metformin, and if you haven't checked out the video on metformin on YouTube, check that one out. Should you take Repatha or probably if your LP is high? Joan, I answered that question specifically on the cholesterol video. So go to youtube.com/Dr. Nally, look up total cholesterol and LDL on that video. And I talk specifically about why that is something you may want to consider not doing if you're following a ketogenic lifestyle. Let's see, what's the best way to strengthen your immune system? Amazingly, this is. So what's important to understand is that your immune system is balanced by CRP. And if you're actually shrinking the fat cells and your tumor necrosis factor alpha and interleukin-6 are balancing, your immune system actually gets better. And that's how this helps. Why can keto help with some tumors? Keto helps with most tumors for two reasons. Number one, it's diminishing the presence of glucose as a primary fuel, which 95% of cancers thrive on. And you're shifting to fat as the primary fuel, and 95% of cancers can't grow in the presence of fat as the primary fuel. Then second, you're decreasing the stimulus for tumor growth, which is essentially this tumor necrosis factor alpha and interleukin-6 in many cases. Not all, but in many. Why is my morning fasting sugar still in the hundreds? Because it takes almost 2 years, Julie, for insulin resistance to improve. And it's really driven by the overproduction of those fat cells. So getting those fat cells to shrink will cause those to drop back down. That really, truly is the issue. And this is where I like exogenous ketones. And the reason I like it is this. I'm going to click on a slide here and show you exogenous. And this, I actually did a post a bit ago about exogenous ketones. And people freaked out thinking, oh, you use them. Yes, I actually use them. And the reason is that the presence of ketones has a further suppressive effect on tumor necrosis factor alpha and interleukin-6. And so for someone like me who's very insulin resistant, and I can't get my ketones up very high because I produce such a large amount of insulin right here, using an exogenous source to push that up further actually enhances that benefit. And so that's one of the things it's not so much for weight loss, but for enhancing the overall metabolic benefit. So that's one of the reasons I've been using exogenous ketones for the last 3 years. All right. I believe it's also oxalate. I'm not sure what that statement is about, Sheena. I totally don't understand what you may want to clarify that. Loose stools on keto nearly 3 months, too much fat, Muriel. If you're having loose stools on keto, that means you're taking in too much fat and you need to back the MCT off. MCT will give you loose stools every time. So it means your body you're taking in too much fat for your body to absorb and you don't need that much. Caloric needs after hysterectomy are no different than your caloric needs that you had with the hysterectomy or with the uterus, Mary. So I would say there's no difference there. I've been doing keto for 2 years, not even a cold in that time. That's not uncommon, Janet, to see that. Will it help get rid of lipomas? In some cases, Linda, yes, but not in all. I've seen it improve. There's been no specific study on that, but in some cases, yes, it actually does. Let's see here. Kathy says, that's what I wanted to know. How long to reduce insulin resistance? About 2 years. It takes about 24 months for insulin resistance to improve and those fat cells to shrink. It took you at least 2 years to get where you're at. It's going to take about 2 years to reverse that, but be patient with it. Oh, turmeric. You were talking about oxalate and turmeric. I'm not sure what your question was there, but that's hopefully that it was clear. Let's see. Oops. Hold on there. Let me close that. My computer's throwing a bunch of stuff at me. Let's see, dude. Let's see. Becky says, I do take exogenous ketones, but heard so many different opinions on how it's not needed. Okay, so let me give you a clarification on exogenous ketones. Do you have to use exogenous ketones to be in ketosis? Absolutely not. Can you do a ketogenic diet without exogenous ketones? Absolutely. Will exogenous ketones speed up your weight loss? Not necessarily. They're effective in those of us that are really insulin resistant, as I talked about just a minute ago, but you do not have to use them. People said, well, why would I use exogenous ketones if I'm making them myself? For the same reason that you drive a car instead of riding a horse, you get there faster. That's the whole point behind it. So when people say, oh, you're just cheap, why would you want to use exogenous ketone versus the ones you're burning? And I understand that concept from the perspective of weight loss, but I treat more than weight loss. I treat full spectrums of disease, diabetes, the insulin resistance issues, the cancer growth, all those kind of things, memory, inflammation, all those pieces. And the perspective is this: if you want to speed the process along, why ride your horse when you got a car? Before we had cars, all we had was horses. Now we got carbs, if that makes sense. So hopefully that gives you some clarity. Do you have to use exogenous ketones? No, but there's something that I've chosen to use because I've seen the benefit in regards to memory, cognition, the improvement in the inflammatory processes, decreasing insulin resistance at a faster rate, and focus, as well as enhancement in regards to muscle retention and exercise. As I use it as a pre-workout and post-workout drink. There's a number of reasons to use them. Really, it comes down to what are you wanting, what are your goals, and will that actually affect it and will be beneficial? So that was a really long-winded answer. What do the goats think about the 113-degree heat at my house? They don't much care for it. Let's see. It took me 2 years to see blood sugar under 100. Yes, Janet, it does. And that's very common for a lot of people. And we were talking about there are many opinions about it. I've studied these for a long, long time. I've been doing this for almost 16 years. And so what I find is there are really only very few products that I use beyond real food, and exogenous ketones are one of them. And I use them for specific reasons. And so that's why I use them. I've been using them for a long time. It is confusing, Becky. Let's see. Do you drink your ketones during fasting or eating window? That depends on what I'm doing for fasting. If I'm fasting just to reduce meals, yes, I use exogenous ketones as an appetite suppressant. If I'm fasting for religious reasons, I don't use them. I do a pure fast of both food and water. So there's a number of reasons that I do fasting for, and so you just have to decide that. I found coconut oil causes me autoimmune flares. Sheena, it can do that for some people. My suggestion is use real food to get your saturated fat. You only need to cook in coconut oil or add it for various reasons. Are skin tags a sign of insulin resistance? Yes, Crystal, I've talked about that before. They actually are. Do CRP test results fluctuate easily? They will literally fluctuate within 24 to 48 hours. So they are going to fluctuate based on your insulin responses. And so I'll see CRP high one day and down the next day. So yes, they have a tremendous fluctuation that drives that. How many times do I do a day? Do I use them? I use them 2 to 3 times a day, sometimes 4. How long does to lower blood pressure? Usually within a couple of weeks, you'll start to see the pressure drop and start to lower, but you may not hit a normal for a few months. Sometimes 6 months if you're very obese and very insulin resistant. Will weight loss be quicker after 2 years? Weight loss will be quicker as you gain more muscle mass. So that's really kind of where it comes down to. What happens after weight loss and stopping the exogenous ketones? What happens after weight loss? Your body will find a natural point of based on your exercise levels, your energy levels, and what you do physically, your body will find the point where it feels comfortable holding on the weight. What happens after stopping the exogenous ketones? Nothing happens, because you're using them for specific reasons, not specifically for weight loss. I don't use ketones for weight loss. That's not why I use them. That's not why I recommend them. How does a person know if they're very insulin resistant? Because they have skin tags. Paula says, thanks for your time. Oh, you're very welcome. I know there's a ton of questions on here, guys. So I appreciate you guys listening and hanging out, watching. Please follow this. If you like me, follow it here. Go to YouTube and follow me there and subscribe there as well. I have 4 nodules on my right lung. So if they shrunk on keto, well, I hope so. That would be exciting to hear. I'd be curious to hear about that. I got a job, so coming for a visit. Okay, cool. Do I count calories, macros? Not at all. Calories are a swear word in my office. Will exogenous ketones make me lose weight faster? Not necessarily, Michelle. I don't use them. They won't speed up your weight loss. In fact, in some cases, they might slow the weight loss depending on how you're using them. I use them as a meal replacement and to maintain hunger control. And so in that case, that's how they seem to be effective for me and many of my patients who are really insulin resistant. Tell me what to do to fix myself. Well, that's what you got to come and chat. I answered that question already, Crystal. Let's see. If combining coconut drink that you recommended yesterday with exogenous ketones won't set off my insulin response. No, I checked myself 3 times, Julie. The drink that I posted actually does not spike my insulin, and actually helps me maintain my ketone levels. So that drink is actually really cool. And it's the way I get salt in as well. Thank you for your clarification using ketones. So Stephanie, I'm a big proponent of exogenous ketones when you're using them for specific reasons and you understand why you're using them. There are a lot of docs that poo-poo it and say, oh, it's just crap. Well, the issue is they're speaking specifically about weight loss. I actually treat more than weight loss. Although I'm an obesity doctor, I'm also a family physician, and I treat a full spectrum of disease. Insulin resistance causes 16 different disease processes. And so weight gain is one of those issues, but there are 15 other issues that we're dealing with. And so I use exogenous ketones to help modulate the hormones in those other disease processes. I eat carnivore and my fasting blood sugars in the hundreds in the morning. I need to know if that's bad or good. If it's under 100, I'm happy as a clam, Robin. I'm not totally sure what you mean by bad or good. You are very welcome, Rhonda. I love to give you guys education because there's so much false and misinformation out there. For those of you who don't know me, I'm Dr. Adam Nally. I'm a board certified physician in family medicine, also board certified in obesity medicine. I'm also a health policies fellow. So if you see my personal page, you see lots of political diatribe. So if that's kind of what I do. I've been doing this for about almost 16 years in regards to ketogenic lifestyles. I've been in practice about 20 years. And so I've been doing this a long time. And I'm pretty comfortable with what I do and why I do it. I realize there's a lot of different voices out there that you hear, and that's a challenge. So this is why I put this stuff out here to try to provide science-based information. Do I know anything about Prader-Willi? Yes. I have one patient that's done keto with Prader-Willi. But Prader-Willi is a genetic issue that you have to watch closely. Keto meal replacements and shakes. I don't recommend them. Most of them have sweeteners that are problematic. And if you read the chapter on sweeteners in my book, you'll know which ones those are. And the book is The Keto Cure. Let's see. Do you know how much fat to protein to use daily? That depends on your height and your exercise activity, Tracy. And you can find that in my book. You can also find that on my blog. If you go to Dr. Nally or docmuscles.com /blog and type in protein, there's a protein calculator on there as well. Hey, Anna, how are you? which exogenous ketones do I suggest? I've tested all the exogenous ketones out there, and the two that are most effective for me are Pruvit's ketones supplements. Now, they're more expensive because they're a direct marketing company, so their cost is literally twice as much. And then a company called Ketology I've used for a long time, and I love their product. They have two really good flavors. Unfortunately, the other exogenous ketone products did not work for me. They did not get my ketone levels up, where those two, Pruvit did and Ketology did. So I like both of those, and I use them both regularly. Keto for 3 years. I have a cortisol issue that's, let's see, will exogenous ketones help curb the new problem with cravings? They often do, Andrea. Not knowing your medical history beyond that, I don't know what I have to see you specifically to answer that. But in most cases, the exogenous ketones play a big role in curbing appetite, especially with cortisol issues. Cardiologist going, but LDL has gone I'm not quite sure what that means. David, I have to see you directly to answer those questions about individual cholesterol issues. Let's see, can stevia influence insulin? Well, if it's liquid stevia or stevia glyceride, no. But if it's a crystal form, yes, because the only way that you can make stevia a crystal is to bind it to dextrose or maltodextrin, and that's actually a form of sugar. Good to see you again. Oh yes, Mitzi, good to see you as well. Sheena says, love to hang out, learn. Thank you guys. You guys are awesome. Is it okay to use amino acids? Sheena, I am not a big fan of using amino acids because you can get amino acids if you eat real meat. So I don't add any amino acids. I don't think that's collagen is an amino acid, and the BCAAs are amino acids. I don't recommend them. I say eat real food. That's the big key. Good ideas for dairy-free fat bombs. Dairy-free, are you referring to not using butter? Is there a reason that you don't want to use butter? Because butter's like golden. Had bacon as a snack before this. Oh, awesome. Let's see. Joan says, you're watching me on vacation. Well, in Thailand. Joan, you know what? I think your doctor needs to come check and make sure you're safe in Thailand and that you're actually truly keeping it keto or carnivore. So, if you need Dr. Nally to come and make a house call, I could do that. Do you find metformin XR as effective as regular? There are reasons for using metformin XR versus the other. The biggest issue to use XR is less diarrhea, but they both seem to be equivalently effective, Amy. It's just it's side effects that I'm looking at there. Last CRP was 5.7. Awesome. My keto hero. Oh, thank you, Gina. You're very kind. You guys are flying the questions in here. I'm not keeping up. Let's see. Love the superb education. Low carb. 3 years. Ended up on type 2 doorstep. Skin tags. They will take about 2 years as that insulin resistance gets better, DJ. So be patient. They will disappear, but be patient. Insulin resistance, along with my PCOS, some of the worst ever. How would I learn more about exogenous ketones and would they help? So Lisa, the key with PCOS, and I would highly recommend you get my book. I actually did a whole video on PCOS on YouTube as well, so I checked that out. The key number one is being in ketosis. Number two, using exogenous ketones for the suppression of insulin and CRP, as well as modulating your testosterone, would be something I would consider. And there's a study on that, so I would be that would be something I'd look at really closely. You're reading my book now. Oh, thank you, Kathy. That's awesome. First time you've ever caught me live, Jeff. Well, welcome. It's good to have you. Let's see. Anna says she has my book on her nightstand. Thank you. Can successfully do keto if you don't have a gallbladder? Oh, yes, you can. My wife doesn't have a gallbladder, and I have hundreds of patients that don't have gallbladders, and they do keto phenomenally well. That is a myth. You can do keto without a gallbladder because your liver still makes bile. It just doesn't have a big old bag to dump it out when you have sugar and fat together, because you're not eating sugar and fat together. You're just eating fat. The gallbladder is necessary for a sugar and fat load. So if you have a donut, if you have Indian fry bread, if you have a scone, that's why you need the gallbladder. But you're not having any of that if you're doing keto, are you? So there you go. You don't need a gallbladder. Where do I practice? I practice in Surprise, Arizona, Carla. Hopefully that helps. Let's see. Yes, I talk fast. Thanks, Anna. Will your supplements be balanced, help balance out? Yes, it does. Had pellets inserted 6 weeks ago. They will help you balance. But Mark, if your testosterone was that high, then your pellet was probably too strong. I work with a cardiologist and I've talked two of them into the diet. Oh, that's awesome, Janet. Fantastic. Let's see. Carnivore for 1 week and it's magical. That's awesome, Gina. I love to hear that. Is pool walking good for exercise? Yes, it is. It's a good low impact exercise. Do I recommend fasting over 24 hours? So the issue is I'm not a big fan of fasting for longer than 3 days because of the effect it can have on the thyroid. And my question is, why fast over 24 hours? You're not going to see any additional apoptosis that you would with a 18 to 24 hour fast and a 48-hour fast. Usually you're going to see just more. The challenge with prolonged fasts is you're going to lose weight, but you're going to regain that weight because a lot of it's water weight that's lost. And your body's going to attempt to maintain homeostasis. So you can fast for prolonged periods of time, but you're going to see this yo-yo effect with the fasting. My suggestion is let your body tell you when you need to eat. If you're fasting a couple times a month, once or twice a month, 18 to 24 hours, that does everything you need for speeding up apoptosis, cleansing out your liver and your colon, does all those wonderful things. I have not read a study yet that shows me any additional benefit of fasting longer than 24 hours. And if it's out there, I'll eat my hat and do something different, but I've not seen it yet. This is the nasty hat I run with and hunt with. And so I will eat this hat if there's a different study out there that tells me differently. All right, let's see. A1C down from 6.1 to 4.7. You guys are awesome. Oh my gosh, this is incredible. Pork rinds, is it good fat? Now, pork rinds are mainly protein with fat. They're the higher content of protein. But yes, I love pork rinds. In fact, my wife ground up pork rinds yesterday and rolled Parmesan cheese in them so we could fry them. And I can't wait to taste them. Let's see. Last CRP was 85. So Nancy, that means you've got something going on, some significant inflammation or an infection. And something's driving that process. Now, see, that's why CRP is a very general, broad number, so it's hard to determine what would be causing that. That's where you have to sit down with your doctor and go through a history of what may be driving that process. I'm not sure what that comment is related to, Anna, but let's see here. What is the name of my book? It is on Amazon. The name of the book, someone type it in the chat bar if you would. It's called The Keto Cure. I appreciate that if somebody typed that in there. Oh, that's a conversation between Jeff and Anna. I'm sorry. Let's see. No gallbladder and down 70 pounds. Congratulations, Denise. I am way behind on these. Let's see. The Keto Cure on Amazon. That's the name of the book. Thank you for typing that in, Marnie. I appreciate that. It is on Amazon. Is it possible to get an ulcer in your throat from silent acid reflux from too much fat? Angela, the reflux is driven not by the fat. The reflux is driven by the high carb intake and the effect it has on CCK and relaxation of the stomach sphincter. So it's not the fat that drives that acid reflux. It's the carbs with the fat that drive the reflux. Reflux gets better by 65% on a ketogenic diet. And there's like 3 studies that show that. Let's see. She says the Keto Cure. Thank you for doing that. All right. You are the bomb, says Lisa. Oh, you're very kind. Ordering the Keto Cure this week. Thank you, Cindy. I appreciate that. Propranolol. Propranolol is a broad spectrum beta blocker for blood pressure and for other reasons. We use it as well. And it will cause a stall every time, Jennifer. Yes. So talk with your doctor about a more cardioselective beta blocker if you need it, or weaning off the beta blocker as you're losing weight and your blood pressure is improving. It will cause a stall. Yes. We talk about that in my book as well. Am I taking new patients? I am, Carla. Robin, I don't quite know what that means, but let's see. Diabetic husband's doctor told him not to do keto. You're seeing a new doc soon. Smart woman, Kathy. Smart woman. Jeff says, I love being in the water. Oh, the water's great, Jeff. So no problem. Hello from Elma, Washington, says Susie. Welcome. Propranolol is it's an older beta blocker blood pressure medicine, Jennifer. Hopefully I clarified that for you. My testosterone is less than 0.1. But you can't get your doctor to optimize it. In Tasmania, Australia. Oh, Carrie. Well, then I would suggest you find a new doctor and someone that understands that. Get what you and husband. Oh, she's talking to somebody else. Okay, let's see. Highly recommend listening to the podcast, Straight Up Wellness with Dr. Nally. Thank you very much, Kimberly. You're very kind. Eating the chicken skin on the chicken thighs, is that good for fat? Yeah, it's great for fat. Fantastic. Let's see. Hello from Perth. Hi, Leah. Are you taking new patients? Yes, I am. Just call the office. It's on my website. You can go to nallyfamilypractice.com. That's the website for my office. Let's see. Thank you for putting the name in here. Let's see. Margie says A1C 5.2, had fasting insulin at 1.5. Oh, that's fantastic. That's not a dawn phenomenon. Are you having a dawn phenomenon? Is that what you're asking, Margie? Those numbers are fabulous. I love those. Let's see. A year on keto, down 30 pounds. A1C is at 5.6. That's fantastic, Gail. You guys are awesome. Congratulations. 3-day thoughts on a 3-day bacon fast. You know, if it's real bacon, I have no problem with that. The challenge is people get bored with food, and so I'm not a big fan of bacon fasts or egg fasts or fat fasts, just because my suggestion is just tighten up the carbs. One of the reasons carnivore works for so many people is there's a lot of complex carbs that are in other foods that sneak into people's diets. And so one of the things I recommend is if you shift to a carnivore type diet, you're cutting out literally all the other complex carbs from veggies and fruits and things that people sneak in thinking, oh, these are okay, I can sneak by. But if you're really insulin resistant like I am, you've got to tighten those carbs up really tightly. So hopefully that helps. Celebrating the progress thus far. Awesome. Oh, she's still communicating. Let's see here. Okay, guys. We got to the very end of it. See, my C-reactive protein is 2.5. That's fantastic. Is that why I felt bad for 8 years? C-reactive protein should be under 6, Sheena. So I'm not totally sure. Unless you're that's if you're feeling bad, there's probably other reasons there. I'm not totally sure what your other history is about. You'd have to see me or your doctor about that. Margie says she's having some dawn phenomenon. Then if you're having a dawn phenomenon, then Margie, then I would probably talk to your doctor about checking a C-peptide. And I would probably want to get a continuous glucose monitor, see what your glucoses are doing and see if it truly is a low sugar. Sometimes if you're not eating enough protein, that can play a role. I have a lot of women that don't eat enough protein. I don't know your history. You may be doing okay, but sometimes a lot of women are afraid to take the protein and fat levels up a little higher. And so their blood sugars do bottom out in that regard. So something to consider in that regard. Blood sugar and reflux have gotten worse since keto. So Michelle, if your blood sugar and your IBS got worse, then you're probably not keto. And you probably need to look at the amount of caffeine and other stuff that's in your keto foods or keto products that you are often using. I have yet to see somebody who's really using real food that has a problem with it. There's too much keto crap that's being sold out there. I'm going to be frank. I went to a conference the other day, and there were 500 vendors for keto foods. And of the 500 vendors that were there, 3 of the products were products that I could use personally. So you have to be very careful with that out there. So something to be wary of. Let's see. Any concerns for chlorothalidone? Well, any blood pressure medicine will slow your metabolism slightly. So just be aware of that, Andrea. And the goal is weaning off those blood pressure pills as you're losing the weight and you're getting more healthy. Dehydration cause low blood sugars? Yes, it could, Jennifer. That's a possibility. If you're dehydrated, that could do it. What's the difference between C-peptide and fasting glucose? So, Leah, C-peptide is a precursor molecule produced by the beta cell. The C-peptide and insulin come out together, and then there's a little enzyme that cleaves off the C-peptide, and then insulin is now active. You can measure the amount of insulin being produced at the pancreas by checking C-peptide. We check our type 1 diabetics to see, are you making any insulin on your own by checking the C-peptide level? So hopefully that clarifies that. All right. Well, guys, I am getting hungry. My stomach is growling, and I'm going to go eat. You've been fantastic. Great questions, and congratulations on all the successes that you guys have posted there. Love to hear it. Check this video out. It'll be on YouTube coming up in the next few hours. Hopefully you guys have a great Sunday evening. Check me out on YouTube. Check my website at docmuscles.com. Subscribe down below if you haven't yet. If you haven't followed me on Instagram, I'm in Instagram, and I log in and put a little quote and a little exercise. Try to do that every morning if I can. But have a great afternoon, a great day. And remember, keep the fat high, keep the carbs low, and pass the bacon. Take care, guys. Have a great evening. Good night.